of the biggest factors in whether patients, are candidates for this procedure are the patient's expectation. We have patients that come in here and their expectation is that they would like to return to running marathons. We have other patients that come in and if they could get up in the morning comfortably and walk across the grocery store for an hour or two, that would be an enormous success. So defining what the patient's expectation is prior to moving forward with the procedure is one of the key aspects as to whether or not we can call this procedure successful. Patients that do terrifically well with this procedure are patients that have their expectations in line with what we're capable of doing. And we really try to lay out for the patient what we think we can expect from this procedure. What joints don't do well? There are joints that I consider too far gone. Bone on bone usually means from the time that an orthopedic surgeon says, I have an arthroscopic procedure that I can do, to the time they say that this patient needs to have a knee replacement. That whole section of time becomes bone on bone. And most of the patients that we treat would hold a classification of bone on bone. It simply means that areas of the joint where the cartilage would have been nice and smooth and clean throughout the joint has had somewhat of a degeneration. And those are the areas that we treat really, really well.